You all right?
Nurse! Nurse!
That'll do now. Be quiet.
Nurse! Nurse! Blanket!
Quiet now. You're waking the rest of the ward.
Nurse! Blanket! Cold!
Come on now, Paul. Settle down.
Nurse!
I don't understand him, do you?
Oh, but I wish you'd keep quiet because he's really making the rest of the ward.
There. You must be cold. Try and get some sleep.
The issues that have come through, the complaints that we've received about individual patient care, about communication, about staff's attitude and behaviour, and I passionately do believe that that's not because somebody wants to do a bad job, that they've maybe portrayed themselves in a less than helpful light. It's maybe sometimes that they don't understand or they're not fully clear about how to go forward and to help somebody who's got a very obvious or sometimes not so obvious communication issue or a behaviour that would not be quite how they would expect somebody to behave. So this is about equipping our nurses, this is about giving them the tools and hopefully bringing a little bit more insight into how best they can do their job in order to provide a person-centred approach.
This sketch deals with using observation when verbal communication is limited.
Are you comfortable?
Aye.
Let's get you covered up. The doctor will be with you shortly.
Thank you, nurse.
Morning, Sean.
Good morning, nurse.
How are you?
You got lovely hair.
Sean. I just want to check what you want for your lunch today now, Sean. We have A, chicken casserole, B, chili con carne, or C, there's a vegetarian option.
Oh, dear God. I don't like vegetables.
All right, then. Well, sure, we'll put you down for chili con carne.
That's okay. Will you be my girlfriend and take me the pictures?
Sean, you're a wild man.
What's happening, bro?
I got a new girlfriend today. She has lovely hair. She asked me what I wanted for dinner.
What are you having?
I can't remember. She said something about B.
Something about B. Chili con carne? Sean, you're not allowed spicy food, you know that?
I didn't know what it was.
Does she not explain? Oh. Chicken casserole, chili con carne, or cheese omelette? Sean, cheese omelette are one of your favourites. Why don't you take that?
She never said cheese omelette.
It's actually more of a necessity to ask more questions and to explain everything that you're doing, to make everything clear and ask the person that you're explaining it to whether they understand.
All the stuff we do with Lilliput, we're trying to make things quite positive. But the uncomfortable message is that there are avoidable deaths of people with learning disabilities in general health care. And there has been a confidential inquiry into premature deaths. So at one level we're trying to say there's important things about communicating with people. It's actually how we say this isn't just about being nice to people. It's getting the accuracy of information that helps you make better decisions.
You'll see as the DVD wears on, there's going to be some conversation pieces that have happened with parents and carers of children and adults with learning disability or autism, and they have given us some very good ideas and some good concepts of how to manage a situation in an emergency department or an outpatients department that is very much person-centred and person-focused. Okay, good afternoon and thank you very much for joining with us. I'm going to ask you to introduce yourselves and tell us a little bit about yourselves.
My name is Juliana Harkin and I'm a mother of 3 boys, 2 of them with autism, and I'm also a director and co-founder of a support group for families with autism called Circle of Support for Autism Families.
Okay.
I'm Carrie and I'm a mother of 3 as well, and my youngest son has autism, and I'm also co-founder and director of COS for Autism Families.
Okay. Tell me a wee bit about COS, what it is and what it does.
We set it up 3 years ago because we found there was a lack of support in all areas for parents with children with autism. As a group, what we do, really what we go around trying to do is make things autism friendly. We organise it with the cinema, with all of the events that we run for the children. We try and get the events to be autism friendly, and by when we go to the cinema, the lights are turned up, the sound is turned down. I mean, and what we're trying to do as well is approach public places and try and have autism friendly environments in them, you know.
Obviously, picking up from that, there are some things that you do that would make the environment less stressful or threatening for a child or teenager with autism. How did that work in a hospital?
It's awareness. One of the big things is awareness. If staff are aware of how autism can affect a child, and bearing in mind that autism, it's called ASD, Autistic Spectrum Disorder. There's a varied spectrum. Some children with autism and teenagers, adults, can be highly functioning, and it is also known as the invisible disability. So you don't know to look at that person that there is anything wrong with them.
And because it's such a broad spectrum, you have very severe can't talk to over talks, but I mean they still would be affected by the lights, by too many people, and the one thing I would say that because the children are so different, the staff need to listen to the parents or the person that's there. They need to know specifically, your child has ASD, but what are his issues or what are her issues? You know?
You're saying his issues because autism does affect 4 times more boys than girls.
Right.
So it's a lot more prevalent. You know, so there's sensory needs and things that can set them off. We call them meltdown, the difference in a meltdown and a tantrum. It may appear to outsiders and to staff that the child is just being badly behaved or having a tantrum, where actually that fluorescent light that's above your head is buzzing and they can hear that buzz. Right. They can hear everyone talking at the same time. It's overloading them. The lights may be catching their eyes slightly different from the way it's catching everybody else's. The smell. And we know that in a hospital environment, these things are there. We can't change them, but we can understand how those things are affecting our children and maybe take little steps to minimise the effect on them.
Or even to provide a small area, not necessarily like a separate waiting room, but a small area just that they could avail of if they are having difficulty.
Or allow them to leave the department to an environment that's more suited to them. You know, as long as they make the staff aware that they're going to take a walk to the shop or they're going to walk outside the door, you know, and so that they don't miss their treatment.
Okay.
And it reduces the anxiety levels, which makes everything easier for the parent, the child, and the staff.
Mm-hmm. Okay, so I think I hear you say that if we had somewhere for you to go, a quieter area, or the ability to leave the unit without missing your turn in the queue, so that's all about good communication.
Yes.
Okay. What about whenever a child with autism would need to be admitted to hospital? What can we do to make that an easier journey?
We just need to prepare them. and allow the parent access to where they're going to be, who they're going to see. You know, I know it's very hard to try and pinpoint down one nurse, but I mean, if the doctor is performing the surgery, should we not be allowed to get a photograph of the doctor? I mean, a lot of these children too, you have to think about it, they use visual aids, you know, they use PECs, picture communication. So that's their communication, so they need it. Okay. So you have to really make allowances to, like Juliana, you know.
My little boy's due for admission this week, and I have found it very difficult to try and get the information to prepare him. We have finally got some information, but it shouldn't have been so difficult to get that information. So now what we can do is produce a social story for him, and we will cover that social story several times a day between now and his admission, so that when things happen on the day, he is in some way prepared for them. Right. Pictures of the waiting area, pictures of the theatre, pictures of the recovery room, a nurse in uniform, someone from theatre in theatre scrubs with the hats and the masks, so that he's not going to be scared by these things when he sees them. And being able to reassure him that mommy, as far as he'll be aware, will be with him all the time. You know, I can be there until he has had his anaesthetic. I can be there when he comes around again. So as far as he's concerned, mommy's going to be with him all the time.
Okay, so those are really very simple things that we could organise, but things that would make a dramatic difference to your stress levels as mum and dad, and also for the individual child. Yes. Okay, I just picked up on, you indicated that there's a spectrum for autism and children can be at one end or the other end. Mm-hmm. How would somebody like myself and staff working in a very busy department be able to recognise the signs or symptoms?
There is information out there. We as a group produce a leaflet that was designed for waiting areas of health centres and clinics, showing the signs, the early signs and symptoms, the things to watch out for that may trigger you that it could possibly be autism. Okay. So maybe information like that, you know, given to the staff, things that you mightn't think of, inappropriate laughing and giggling, not responding to when you call their name, not making eye contact. You know, those are maybe things that a member of staff can say, right, that child's not making eye contact with me.
Mm-hmm. And then you have the other end of the spectrum where they come over and they'll chat about their specific topic, you know. So it is really, I think you would really have to put in place some type of awareness of what is autism. Like
the stethoscope, you know, a doctor with a stethoscope, and a child could pick up that, what is that? What's it for? How does it work? You know, show me how it works. Let me see it. How many parts are there? What colour is it? Does it have to be that colour? Mm-hmm. They can become obsessive and they want to know everything about it. And that can be difficult for a member of staff who is under pressure with a lot of patients. Yeah. But just kind of take that split second and say, okay, this child's not just being awkward. There really is a reason why they're doing what they're doing.
That's very helpful information. What about an outpatient scenario coming up for something that's pre-planned? I know we've talked about admission to hospital. Is there anything in particular from an outpatient that we could do?
Appointments first thing in the morning or last thing in the evening. Maybe allowing a little bit longer time-wise for the appointments, because it can take a while to settle the child and to get the information. Bearing in mind you have to talk to the medical professional, but you're also trying to stop the child from having a complete meltdown because of their sensory needs. Okay.
Again, just try and cut down on the waiting times.
Yes.
You know, if you're given a time, try and have them in on time.
Okay. Well, that's very practical information that we could have a look at and see what we can do to support the request that you've just made. Okay, well look, thank you very much. That's actually been very helpful, and I appreciate you taking your time to come in, so thank you. The Circle of Hope ladies, what they had to say was tremendous. I have to say that even in that short conversation that I had as an individual person, I learnt so much. First of all, about the behaviours of children with autism. I think my respect for parents with children with autism just went up through the roof. I think it made me feel very humble that we to date, probably as healthcare professionals, are not just getting this right yet, and that it is all too easy to think that child is behaving badly. So there was something there that unlocked an understanding in my head and my heart, which made me realise that we desperately need to make sure that our staff can see these children as individuals who are not setting out to be difficult, but sometimes how we behave makes it difficult for them. And so therefore, together in partnership, I think we need to work towards a more mutually common understanding of the needs of both parties and try to work towards making sure that we're doing the very best for their children that we possibly can.
My name is Sheena and this is Aisling, and we both work with a man who has special needs and who is profoundly deaf within the community, and we've been working with him now. Aisling's been working with him 5 years and I've been working with him 2, so that's what we've been doing.
Okay, tell me, what's the single biggest challenge that you have in caring for this gentleman? What's his name?
His name is John, and the single biggest challenge we have is basically the communication. He would use ASL, which is Irish Sign Language, which is his main form of communication, and it's his only form of communication. So we actually went on and took it upon ourselves to do a course in the TAC and to get our stage 1 in ASL.
Okay, and tell me, if I was meeting John for the first time, I would have no Irish language skills whatsoever. So how would I communicate with him?
The best way, if you were first to come into contact with John, would be very much attitude, making sure that you're welcoming. A smile goes a long way. Just being happy and friendly, having good eye contact with him and speaking directly to John. Using your gestures. You don't have to have Irish Sign Language, but even just gestures like thumbs up to show.
Acknowledge him, exactly.
But John's very much, if you're willing to learn and show that willingness, he's very much there to help you, and he loves seeing people wanting to learn and showing them the signs that's needed.
He loves interaction, is right.